Welcome, everyone. And on behalf of the Southeast Mental Health Technology Transfer Center, we're pleased to present a panel with the Georgia Mental Health Consumer Network on perspectives in crisis, peer experiences in mental health crisis. And without further delay, we'll turn it over to the representatives from Georgia Mental Health Consumer Network.
Good morning, everybody. We're so delighted to be here with you to speak with you about peer perspectives on crisis. I'm Sherry Jenkins Tucker. I'm the Executive Director of the Georgia Mental Health Consumer Network, a certified peer specialist and a person in long-term recovery. And what that means for me is I do what I need to do every day to take care of my behavioral health concerns so I can suit up and show up for my life. Welcome.
Thank you, Sherry, and good morning. My name is Rosalind Hayes. I'm a person in long-term recovery, and what that means for me is that on a daily basis, I do what's necessary to take care of my behavioral health concerns and my addictive disease challenges. And what that has allowed me to do is to participate in things like this. It's allowed me to be a valued employee of the Georgia Mental Health Consumer Network as the Director of Peer Support Services and Training. And it's allowed me to be a daughter that my mother is proud of, an aunt that my nephews love, and a homeowner, a taxpayer, and a valued member of my community. I'm extremely excited to be here with you all this morning for this conversation. I know it's going to be amazing. And so with that, I won't take up too much time and I'll turn it over to Chris.
Good morning, everyone. I'm Chris Johnson. I'm a person in long-term recovery. What that means for me is it's been over 13 years since my mental health concerns have prevented me from leading a full, productive, and rewarding life. Today, I show up, including for things like this. And I'm happy to be here with you today. This series is something we've been excited about for a long time, and it's been great so far. I'm really looking forward to today. We are going to have a full hour and a half, so we will go ahead and get started. And Sherry, who is first on our agenda today?
Miriam Abdulaziz.
Miriam Abdulaziz, always good to hear from Miriam. Welcome, Miriam.
Hello, good morning, everybody. My name is Miriam Abdulaziz, and I'm a person in long-term recovery. What that means to me is I today show up because of mental health recovery. I am a mother of two amazing girls and a wife of 20 years. And I get to serve as a certified peer specialist for over 15 years. I also am the certified work for the certified peer specialist project. And I'm really excited to be here today to share with you some of the things that I have learned over the years and that have benefited other peers. So what I'm going to be talking about is something that you probably have heard before, and that is the Wellness Recovery Action Plan. And could everybody see the screen on that?
Yes, Miriam.
Okay, wonderful.
Yes.
Okay, great. Well, the Wellness Recovery Action Plan was put together by the Copeland Center and specifically Mary Ellen Copeland, who interviewed people with mental health recovery and asked them what worked well and what didn't work well for them, and put all of these things together into what we call WRAP, which is the Wellness Recovery Action Plan. And what WRAP does is it's a wonderful way to help you keep as well as possible. and it helps you avert a crisis. And if for some reason you did still get into a crisis, it talks about what you can do for yourself um, to get your wishes taken care of while you're in crisis. So I just want to start off by, I know there's not a whole lot of time, so this is going to be very, very general. And I just want to start off with the first one, which is the wellness toolbox. The wellness toolbox are things that you can do to keep yourself well. And oftentimes they're simple, safe, and most likely and hopefully free. So, and you think to yourself, you design them for you. You think to yourself, what can I do to keep myself well? What makes me tick? What types of things bring me peace, bring me comfort? And so let me give you a couple examples. Taking a walk could be something in your wellness toolbox. Playing with your pet could be something in your wellness toolbox. Playing music, talking to a close friend, or perhaps meditation. Those are all things that you could have in your wellness toolbox. So if you just take a minute to yourself right now and think to yourself, what types of things do I already have or would I like to use to add to my wellness toolbox? And maybe in the duration of this webinar, you might hear some things from other peers to kind of say, wow, that sounds like something that I would like to do. So that is all about the wellness toolbox. The next step of the Wellness Recovery Action Plan is the daily maintenance plan. The daily maintenance plan is exactly what it sounds like. Things that you do every day to keep yourself well. So that would be things like exercise, or perhaps eat well. For some people, prayer is something that they do every day. For other people, perhaps taking medications or vitamins are something that they do every day. And so it's similar to the wellness toolbox, but it's specific in that this is something that you promise yourself that you'll do every single day to keep well. So you might think to yourself now, what types of things do I do or would I like to do in order to keep well every day? Number 3 is what's called stressors. So oftentimes when we're going through life, there are things that come at us to disrupt our peace. And stressors can be one of those things. One note about stressors are they are things that are external. So things that are going on around us in the community or the society. And let me give you an example of what a stressor would be. A stressor could be something like financial stress. For somebody, it could be the anniversary of a loss of a loved one. A stressor could be hearing people argue or maybe getting into arguments yourself. That would be a stressor. A stressor could be loud noises. That could be a stressor. One time I did a presentation with military folk, and they said that loud noises was a huge stressor for them because it reminded them of back in the battlefield. So stressors are things that happen externally that put up a little red flag to let you know that, wow, something's going on here that's giving me discomfort. And I should kind of take a look at my wellness plan to see what's in my wellness toolbox to help combat those things. All right. Next on is early warning signs. Early warning signs may be a little bit similar to stressors, but instead of being external, they are internal. So things that are going on within your body that tell you that things may need to, that you may need to look at yourself to take better care. For example, if you're experiencing things like anxiety, or perhaps you're experiencing racing thoughts or starting to kind of cry a lot. Those could be stressors, excuse me, those could be early warning signs. Now, keep in mind, with all of these things, this is specific to you. So you are the one that decides what are your stressors, what are your early warning signs, because we are all different and we all have different stressors. We all have different early warning signs. So once again, the early warning signs are internal things that are going on with your own body that throw up a little red flag to say, whoa, maybe this is a time to take a look at things. So for example, if I started getting a lot of racing negative thoughts, and normally I don't have that, then I could think to myself, okay, Miriam, lately you've been going through some really racing negative thoughts. What can we do to tip it back to the positive? And I would go back to my wellness toolbox or my daily maintenance plan, and I'd say things like, okay, what I'm going to do right now is take a nice walk. And a lot of times when you just have one thing that you do, it'll kind of kick you back into gear and put you back on a peaceful path. All right. Well, sometimes things just start to break down. And when things start to break down, it does start to get a little bit worse. And it's like you're heading towards a crisis. But one thing that Mary Ellen Copeland has said is that even when things are starting to break down, you still have control over what you want to do. And so that's when the interventions would be a little bit more serious. For example, you would say, maybe I'll call my care provider or my doctor or my psychiatrist, or maybe I'll call a very close friend or a counselor, or maybe I'll take a few days off from work. Those can be things that when things are breaking down is when things are getting just a little bit more serious in your life. Part 6 of the Wellness Recovery Action Plan is the crisis plan. And the crisis plan is the only part of this whole thing that Mary Ellen Copeland recommends that you actually give to your supporters. The crisis plan keeps you well even when you're not well. So you put it together when you are well, so that it can when you are in crisis, everybody will be able to look and take a look and say, wow, this is what Miriam wanted when she was going through these things. Little parts of the crisis plan. For time's sake, I'm just going to kind of read them a little bit here. What you're like when you're well, who your supporters are, what types of medications you would want or not want. If you stayed at a hospital or a respite stay, where you would go. Other people and ways they can support you. Signs that people would need to take over for you. And also signs that people can give you back the control when you are feeling well again. So once again, the crisis plan is the only part that we recommend that you actually give to supporters that you've identified, and let them know, hey, I'm putting together a wellness recovery action plan, and I have a crisis plan, and I would love for you to be a supporter, just in case anything were to go sour for me for a few days. And so this is what the crisis plan is all about. And finally is the post-crisis plan. The post-crisis plan is that time in which you are healing and starting to feel better, but it's still a very impressionable time because you're recovering from a crisis. And so it's just important to know that there are things set aside to keep you well, even during the time when you are healing. And so that is just a little overview of the Wellness Recovery Action Plan. I hope this was helpful, and that it helps keep everybody out of a crisis. However, if you were to go into a crisis, that you would know what to do. Thank you so much.
Thank you, Miriam. I think next up is Sherry with PAD, and you'll tell us what PAD is.
Hi, good morning again. PAD stands for Psychiatric Advance Directives. I'm happy to report that after more than a decade of work on trying to get psychiatric advance directives put into law in a form that that we people in recovery think is more user friendly than things that have been proposed over time. House Bill 752 was passed this year, and it changed things in the advanced directive code so that we have a more user-friendly psychiatric advance directive available to us to utilize, that is in law, and that can help support us when we do have a time of crisis. The psychiatric advance directive is similar to what Miriam talked about with regard to the RAP and the crisis plan. It is a particular template that we developed, a group of people from organizations across the state worked on this together. And this particular group worked on this particular template for 2 years, and it was passed at the end of the legislative session. The psychiatric advance directives gives a person an opportunity to specify during a time when they're feeling well what their treatment preferences are, if in fact they have a time of crisis where they have difficulty speaking for themselves. And you can identify, what doctors you'd like to have treat you. You can identify what medications work for you. You can specify what kind of support you need, where you would like to receive care and treatment if you needed to receive care and treatment outside your home. And this psychiatric advance directive that passed into law this year gives the opportunity for the psychiatric advance directive form, the pieces of paper that you fill out to speak for you at a time when you have difficulty speaking for yourself, or you can appoint a person, a designee, where someone can speak on your behalf. In the language of the psychiatric advance directive, they're called an agent, and you would certainly want to choose an agent. If you decided to go this direction, you would want to choose an agent, somebody that you trusted, somebody that you could go over with them the psychiatric advance directive that you completed, and get them to understand what you want and need and desire with regard to care and treatment if you do in fact have a crisis. and then this person would speak on your behalf. In my way of thinking, you would want to choose somebody that respected you and would respect your wishes versus somebody that would do things in your quote unquote best interest. Uh, People's best interests for us do not always necessarily match what we desire as people in recovery with regard to care and treatment. So choosing an agent, if you decide to go that route, is something that is very important. Psychiatric advance directives are something that can be very valuable for people who find themselves in situations where they have a crisis and have difficulty being understood or actually understanding what goes on at any particular time and space. And I'm hopeful that we'll be able to do some trainings across the state for people who have interest in developing psychiatric advance directives with regard to supporting people with completing the templates. And they are something that is, that people can have notarized, and psychiatric advance directives are good to have in place where you might find yourself needing care and treatment. So if there's a regular a healthcare provider that you receive services from, you might want to think about having your psychiatric advance directive on file with them. If you choose an agent, you of course would want your agent to have your psychiatric advance directive. If you have close friends or family members that support you in times of crisis, you'd want them to have your psychiatric advance directive. And you always want to remember that each time you update it, because as time goes by, you will likely update it to then, you want to keep record of where you have distributed your psychiatric advance directive, so that then you can swap them out at the times when you do update it. So there's a brief overview of psychiatric advance directives.
Thank you so much. And the next thing we are going to talk about is one of our favorite projects at the Georgia Mental Health Consumer Network, and that's our peer support, wellness, and respite centers. I have had the honor and the pleasure of working with the peer support, wellness, and respite centers since the beginning of my tenure at the Georgia Mental Health Consumer Network. And it was then that I was introduced to the model that we use at all of our centers, which is intentional peer support. And one of the things that we talk about in intentional peer support when it comes to crisis is really, looking at it a little bit differently or redefining crisis. And there's a metaphor that we use, and that is the relationship between fire and the forest, right? And so oftentimes, many healthy forests need fire, right? Wildfire clears out the underbrush so that new life can emerge. And there are some trees that even require fire to drop their seeds. And so, of course, looking at this, you see, it's dangerous. It could be a potential disaster, and it creates fear. And yet that is the means that that's the means by which many forests regenerate. And so the idea is that, interestingly, that if we stop that natural cycle, if we go run in and put the fire out, it leaves the forest more vulnerable, actually. And because of that, putting it out, the underbrush grows thicker and the forest is at risk of completely burning down if a fire comes through. So stopping the wildfire makes the forest less resilient. And so thinking about that, you know, we think about crisis as danger and opportunity. And so often the focus is on the dangerous part, and we miss that opportunity to learn and grow. And so, you know, when we think about crisis differently, we can see or really zoom in on the opportunity there. I know for myself, you know, some of my greatest challenges, some of my greatest times of crisis has been, you know, the impetus for great learning and growth. And so, you know, we challenge ourselves to look at it a little bit differently. Sometimes, or a lot of times, you know, when folks are experiencing a difficult, challenging time or crisis, the response is to run in and to, you know, make it stop. You know, we have to make this go away. And with intentional peer support and at our peer support wellness and respite centers, we stay with people. You know, it's a time for folks to come in, you know, when they're experiencing a difficult time, where they have opportunity to receive peer support and to have someone who is, you know, kind of been there and done that, or who can really empathize with the experience, to be there to listen, to support, and to just, you know, whatever it is that a person is needing, to really support them with that. You know, the peer support wellness and respite centers are places of self-direction where people determine what it is that they want and need, rather than being told what it is that they need. And oftentimes crisis is that code word for taking over. And you know, the person is lost in that, and what it is that they want or need is not even considered. And so the peer support wellness and respite centers are definitely an opportunity for folks to come and have a different experience. If you've never visited one, it's a home-like setting in neighborhoods. Again, self-direction, you determine what it is that you want and need for yourself. It's a trauma-informed environment, recognizing that the majority of people who come into our centers have experienced trauma, because we know that at least 90% of the people who enter the public behavioral health system have experienced trauma. And so at our centers, we think of ourselves as a complement or an alternative to traditional mental health services. And there's lots of things that we do differently, small things that we do differently that make a huge difference. And so intentional peer support being the model, crisis as opportunity for growth, is the position that we come from when supporting peers who are having difficult times or challenges. And Sherry, is there more that you'd like to add to this, or Chris?
We hope that you all that are in Georgia, and we know we've got people from across the country with us, but for those of you that are in Georgia, we hope that you'll visit and perhaps participate at our peer support wellness and respite centers. We're excited to be bringing a new one up in Augusta, really, as we speak here this morning. And there are various types of respite centers in diverse places in the United States, and in some of the states that you all live in. I highly recommend that you check them out. We love our peer support wellness and respite centers, and think that they are really useful places where you can acquire tools for wellness, and to really interface with crisis in a different way, and can move toward things as opposed to away from them.
Yes. And just quickly, at our centers, for those who might not know, some people say we're the best kept secret in Georgia. And so we want to change that. And so basically our centers are peer run centers that offer 3 basic or three main services. We operate a 24/7 peer-to-peer warm line. We offer daily wellness activities, and then we offer respite, which is actually a 7-night stay for you. And we look at it really as a preventative tool or a way of being proactive. We recognize and believe that people, it's like Miriam talked about, we can take care of ourselves, or we can be a part of our own wellness, and so respite is an opportunity that if you feel like, some of those early warning signs, or you feel that the ground is a little slippery under your feet, that would be the time to come into respite, to get what it is that you want and need, in hopes of preventing a full-blown crisis. And very often, when we ask people, what would you have done if you hadn't come into respite? The response is, I would have gone to the hospital. And so it really is, an opportunity to be in a place with people who are your peers, and to experience a very different kind of support. No cold, bland hospital rooms or anything like that, but you have a nice bedroom. And again, you get to do whatever it is that you determine you need. And the peers are there to support you with whatever that is. Chris.
Yeah, before we move on, I just want to say real quick, because I do want to hear our panel. When people ask me, how do I know whether or not I need respite? I say, if you feel like you need respite, you do, because that whole idea of crisis to me is fascinating, because we, to some, there's so much worldview and personal perspective that is a part of it, because to someone who has, been raised up as a millionaire, if you're a Kardashian, having under $100,000 cash in your checking account, that might be a crisis for you, right? Like, oh my God, like I can't buy a Fendi bag today. What has my world come to? But for most of us, like, that is not a crisis, right? Like $1,000 in our checking account, we'd be thrilled. So and I feel like it's the same way with our mental health. Like, we know what's comfortable for us, right? We know how we feel. I think most of us know what we need to be able to get through the day and move forward. And so anyone, if you feel like you might benefit from respite, I say give it a try. So with that, I will hand it back over to you, Roz.
Thank you. Thank you. And now for the moment we've all been waiting for, y'all. This is peer perspectives in crisis. And like Chris, perfect setup, Chris, it's different for everyone, and today we have the honor and the pleasure of hearing from Miss Daisy Taste, Mr. Nigel Greenaway, Mr. Bill Jolly, and Miss Jennifer Barnett, as they share with us some of their experiences with crisis. And I'd like to give each of you the opportunity, when I ask the first question, to introduce yourselves along with the answer to the first question. And so without further ado, we will jump on in. And so the first thing, and Jennifer, if you don't mind, I'll call on you first. How do you define crisis? We started out with in our first in the series with defining crisis. And I'm just curious to hear from you. How do you define crisis? And has the way that you define crisis been different from the way that others around you define crisis?
Good morning, everybody. My name is Jennifer Barnett. I'm a person in long-term recovery, and what that means to me, it's been 14 years since I've been able to work on my whole self. That's mentally, physically, just all of it. And I'm able to suit up, show up for whatever is asked of me today for my family and my employment. For me, personally, the crisis for myself is when I stop caring for me, when I stop making sense and having my racing thoughts or staying in my head too much, and just a lack of interest of anything around me. It's like you was talking about at the wellness centers. And the first thing that popped in my mind for that is, when somebody walks through our doors, we treat everybody with respect and dignity. That is the first and foremost of everything, because you don't get that anywhere else. And from my experiences, I found that I never got it, until I was in my recovery. Crisis to me means so many different things, but what it means to me and someone else is going to be completely different. I can't define somebody else's crisis. I can define mine. And I thought about it, and there's just no way, I can say what somebody else's crisis is. I'm sorry.
No, thank you, Jennifer. We'll go next to Nigel. Hi, Nigel. You're muted. You're muted, Nigel. Nigel.
Sorry, good morning, everyone. My name is Nigel Greenaway. I'm also a person in long-term recovery. I'm also a CPS. And for me, a crisis is sometimes, or not sometimes, but it's a feeling of loss of control, a lack of confidence in my decision-making process, and feeling confused. And, some people have that inner voice that they refer to when they have a decision to make, and generally trust the inner voice. And for me, in a sense, that inner voice becomes loud, and I can't per se trust in it. I question it and can't take confidence in its suggestions or what it's saying, basically, or what it's relating to me about decisions I'm making. And for me, that's a crisis. And when it comes to how it's perceived by others, I really don't know. But for me, as I mentioned, that's for me, is when I need support, need help, and basically need the support of people who I rely on to help me get through this process.
Thank you, Nigel. Daisy.
Good morning, everyone. My name is Daisy Taste, and I am a person in long-time recovery long-term for me is since 2009. I am employed with the Georgia Mental Health Consumer Network as a part of the CPS project team. And whenever you call the center, you most likely will hear my voice. Anyway, what a crisis is to me is when I've lost control of all of my emotions and I don't have the ability or the desire to provide daily self-care, or not being able to pay my bills. I find myself when I am in a crisis, I stay in bed and I don't get up to do anything. Maybe just go to the bathroom, eat stuff that I don't need to be eating. Or the other end of it is I will stay awake for days at a time, sometimes a whole week without sleeping. Not like I'm doing anything, I'm just staring and having intrusive thoughts. And how I see that crisis different from with me is that a lot of peers in crisis have no family and they have no friends or support, and sometimes they have nowhere to live. And or we have very little understanding of what mental health means to us and what to expect after the diagnosis. So I've learned to get up and focus on the things that will let me stay in my lane. And I thank you for letting me share that.
Thank you, Daisy. Bill, tell us how you define crisis. And when I asked that question about as what you consider to be a crisis, different from others who might be observing you, it's kind of like going back to that metaphor of the forest and the fire. Sometimes what I'm experiencing, it's not a crisis to me, but others might see it and think it's a crisis and want to come in and save me from myself or what have you. And so that was what I was wondering with that question.
Okay.
Hey, I'm Bill. I'm a person in long-term recovery. And what that means for me is it's been over 6 years since I felt the need to be harmful to myself, to others. And what I define as a crisis for myself is when I'm unable to take care of myself. You know, it may be I have depression, anger issues, isolation, anxiety. And it could be that I do things like not sleeping, not taking a shower, not eating the foods that I need to eat, and possibly being around people, places, or things that I shouldn't be. I work at a peer support center, and I think for me, I see a lot of this crisis for others is kind of similar to mine. When a person loses their job, when they become homeless, they don't have food to eat, your mind starts racing, anxiety sets in. And so, it's nice to be there just to be able to listen to what they have to say.
Thank you. Thank you. All right. So Nigel, please share briefly about a time when you experienced a crisis. What happened? How were you responded to or treated during this time? And what was helpful and what maybe wasn't helpful? What kind of response?
Sure.
Thank you, Nigel.
Sure. In 2002, I experienced my first crisis. I was confused, afraid regarding the experiences I was having, but I was also seduced by them because there were new experiences. As I said, like thoughts in my mind, like loud and talking to me, but they were supportive at first. And but eventually it turned out to be where I couldn't trust these thoughts anymore, because I was, in a sense, being separated from the reality I had come to know and trust as being the real world, per se, and a reality that was seducing me with new sensations and feelings and experiences. And I couldn't possibly function in both worlds at the same time, or had challenges doing that. And so I was basically hearing voices. And so I called 911 and told them I was hearing voices, and the ambulance came for me, came and got me, and took me to the hospital or the emergency room. And on the way to the hospital, one of the EMS agents or EMS techs told me that perhaps what I needed was just some social supports, meaning that like a social worker, someone to talk to and help me sort things in my life out or something like that. But at the hospital, I was locked in a room, and at some point a nurse came in and asked me some questions, and I understood exactly what she was asking me, but yet as I mentioned, I had my racing thoughts. And the thoughts in my mind were suggesting that, oh, don't believe her or don't trust her. And so there's a bit of paranoia as well. So I gave her nonsensical answers. And then eventually a state trooper or police officer came and got me, put me in handcuffs and took me to Georgia Regional. And this was a very frightening experience. The first time I've ever been in custody, and I was put in handcuffs, locked in the back of a police car, and driven at maybe 80 miles per hour down the highway, trying to get me to Georgia Regional. And I found this experiences, looking back, very undesirable or wasn't supportive of what I was experiencing. And I think what would have mattered was that I was being supported. I was if I had someone to champion me and say, well, I understand what you're going through. Perhaps you'll get through this eventually, and things will turn out okay. Like the services that we offer at the Peer and Wellness Center, but this wasn't available to me at this time. And so this experience made it very uncomfortable. I was afraid, and I just didn't know what was happening to me. Eventually, I was let go from Georgia Regional. Maybe I spent a couple of hours there. Like my mother came and got me, and they released me into her custody. But as I said, the experience was not helpful. I needed support, someone to perhaps just tell me things will be okay. This is a transition for me. I've never experienced this before. Just peers around me who knew or had experienced this before and knew exactly what I was going through would have been very helpful at this point in my life.
Thank you, Nigel. It sounds pretty traumatic to be going through such a distressing time and then to be treated like a criminal on top of that. You know,
it was
handcuffed and whisked away. That, wow. Yeah, we'll be talking about decriminalizing mental health concerns in our next session. Thank you. Jennifer, will you share about a time briefly when you experienced crisis and what happened and you know what helped and what hurt?
You know, that's kind of a difficult thing to really talk about, because I felt that I wasn't sure what was going on with me. I just know something wasn't right. My emotions were all over the place, you know, and I went to seek help. You know, I went to a place that is supposed to provide help. If it was medication that I needed, I was wanting to get on that. And when I walked in here and I'm sitting here talking to the psychiatrist, you know, I just made a statement. I was just, you know, trying to express how I was feeling, you know, and I expressed a statement, you know, I could just die for making my daughter cry because my emotions were so bad. I was snappy at people. I would just jump all over them, and I was angry. I was hateful. You know, I just didn't know what was going on with me. So I went for the help, you know, and when I went for that help, the doctor never even looked at me, never had a conversation with me, never asked a question. You know, he just looked at me, and because I was emotional, I was useless to his time, I guess. That's how I felt, because he took and called the police on me, and I was arrested like Nigel, handcuffed, threw up on a police car, and locked away in a hospital. You know, there was nothing of that situation was helpful at all, and none of that situation benefited nothing. I mean, I lost my job because of that. I lost my apartment. It was a time when I self-medicated myself for not feeling or trying to stay numb to everything. And I took and I just lost trust in the system, you know, so I wouldn't go back and see another doctor because I was afraid of what might happen to me, you know, so I just took and I was back out doing what I did to try to numb some of these emotions, until finally I went to a different route of trying to get support. So, and that was for the addiction side, you know, going through different programs. It helped me to get a psych eval that I needed that would benefit me to try to focus more so on what I do now.
Thank you, Jennifer. And in both what you shared and what Nigel shared, it's this fear response, you know, rather than, you know, responding to what we see at the tip of the iceberg, and just fear taking over, and you know, the treatment from that point goes downhill. Thank you, Daisy.
Okay, the crisis that stood out for me the most is that when I voluntarily admitted myself to Grady on a 1013, I was witnessing behavior that I had never seen before. I was really manic depressed because I had lost my job, and it just seemed like everybody else was doing everything they needed to get done, all my friends, but I thought something was wrong with me. So I was admitted to Grady, and upon admission, I started realizing that I had never seen this kind of behavior before. I was there for 5 days, and in my mind, I was thinking, oh my God, everyone is going to look at me and think I have a mental health issue. I need to do everything I can to make sure that doesn't happen. So the day I was discharged, I went down to the Grady Pharmacy, and now I'm trying to do everything I can to don't look like I have this mental health issue. And when I was sitting there for about an hour waiting for my card, I went up and asked the clerk if I could go and get some coffee, and she yelled at me. And she actually told me it was my decision to make. And I'm staring at her like I'm supposed to make a decision. But anyway, I left from there that day saying to myself, there's no way I'm gonna be looking like I have a mental health issue. So I would get overdressed. I would go to the park looking like I'm going to prom. And then I would wonder, why are people looking at me? So it wasn't until I got a call from Grady Adult Care, and they told me that I should have come to a focus group. I went to the focus group. No one would talk to me. They were just everybody on one side of the room. I didn't know what was going on. So
Were
one
you
day
in
I heard,
prom dress?
yeah, I was overdressed, dangling earrings and everything for 2 weeks. Really shimmery, the sequins, everything. And so one day I heard the other peers saying that they thought that I was an agent or I was, they thought I was going to be snitching on them. And I was like, who, me? And then this lady, I never forget, she told me, she says, why are you coming here every day dressed up like you're somebody? We don't need you to be dressed up like that. And so I started thinking, maybe that's what it is. So I started dressing down a little bit, and I started gathering more friends, and they would talk to me and I would listen. And they were the one that made me realize that I really had issues, because some of the things that they were talking about, I could relate. I was like, oh my God, I really can relate. So I am so happy for those interventions, for them talking to me. Even when I saw people on the train, they would go to the next car. And I was like, why nobody want to talk to me? Something has to be wrong. So anyway, so now I'm able to dress down a little sometimes. And I am very comfortable being around people, and I trust, I have learned to trust what people say, and I learned to value others' opinion. Even they are my peers, and I had to understand that I had a diagnosis just like them. And I learned to work with it, and I've learned to be one of my co-worker here at work told me one day that he gave me permission to be myself. And that was the greatest revelation for me. I was like, you mean I can really be myself? And he was like, yeah, I'm giving you. Every day I wake up now, focus on trying to be myself and trying to help all the people that I come in contact with. And I pray that I don't say things to embarrass them or me during my days.
Thank you so much, Daisy. And it's so interesting, like you're in the park in the prom dress or dressed up, but there was a reason, I heard two things. I heard that you had lost confidence because you lost your job, and that you didn't want to be identified as someone living with a mental health concern. And so it's like, I'm gonna fix myself up and do everything that I can.
Too much.
Yeah, but still, if someone had asked you why, you would have been able to give them a reason that really, in context, it makes sense. Thank you, Bill.
Hey, so the one thing that stood out for me was around 2000, I started experiencing a lot of anger, mood swings. I had started isolating from my family and friends. And I started neglecting my employment. I had been with this company for a long time, and they lost all trust in me. And so I lost my job. Shortly after that, I lost my home. And, you know, I wouldn't seek out, I didn't think I needed to seek out help because I didn't think there was anything wrong with me. I knew I was different from what I had been. But so it took a long time. And in 2016, I think I had hit a place where I no longer could take care of myself anymore. And so I sought out help through the Atlanta VA. And I went into a recovery program with them, spent a year there. And they taught me the things that I needed to know. They taught me how to deal with the anger, how to deal with the mood swings and depression and anxiety. They built me up from, you know, a person that was very broken. So that's all I have.
Thank you, Bill. Can you share a little bit with that experience about you shared what helped when you went to the VA? Were there any kind of responses or interventions that were not so helpful?
Oh yes. So I didn't have a bad experience. I mean, I know there were people there that that I didn't trust, but they took care of me in things that I couldn't do. They helped me get to a focus group, and they helped me to learn how to express what I was feeling, whether it was anger or sorrow. They encouraged me to feel those feelings, to let them out. They taught me not to be afraid of my feelings. And I think it was a lot of the peer support individuals that work there that would give me permission to be myself, give me permission to express how I was feeling. So.
Well, thank you. I hear this learning how to be comfortable in our own skin and this theme of authenticity or permission to be who you are. At our wellness centers and thinking about intentional peer support, connection is the first thing, just trying to be there with someone and support them in feeling seen, heard, and valued. And I know that goes a long way.
Yeah.
All right. We have Daisy, we'll start with you for the next question. What is it that you want or need from people during times labeled as crisis?
The most important thing that I need during a crisis is knowing that I'm being understood. I need a lot of understanding from everyone, and loyalty and reliability. And
When you say understanding, what does that mean? When you say you need lots of understanding from everyone?
That I need for those who are involved to understand what I'm going through, to understand that I would not harm myself. I want them to understand that what I'm going through is a crisis, and it's not me. It's just an illness. And I want them to understand that it's not something that's going to last always. It's something that I can overcome. And then the next thing is loyalty. If I have put or ask someone for support, I would like for them to be loyal to me. If I put them in charge of my finance, I would like for them to be loyal to that. And also reliability. Aside from being loyal, I would like for them to do what they say they are going to do. Because in a time of crisis, I don't need to now have to reschedule or remake plans. So I like for people to be reliable, and by all means, I want to be respected. And that's what I look for. That's what I'm looking for. And during that time, I also know that there are things that I need to do.
Like
So
what?
is to listen and try to understand what I'm being told to do or not to do, or to understand what is best for me at that time. And I would like for everyone to value my opinion, because that means a lot to me. Even the clothes that I'm wearing, or all of that stuff means a lot to me. I just, if I am ill, I want to look good ill. That's all.
Yes, always the fashionista.
Yes.
Jennifer, tell us what it is that you want or need from others when you're going through a time labeled as crisis.
For me, it's mostly just for somebody to listen, to hear what I'm saying without judgment. You know, don't be ready to just take and pick and choose pieces out of what I'm saying to use against me at a later time. You know, somebody to just maybe give me a little bit of validation, saying it's okay to feel that way sometimes, you know, because my sense of a crisis and somebody else's may be completely different. But whatever it may look like, let me be able to trust you, to be able to come to you and sit and have a conversation,
Yes.
and knowing that conversation is sacred between us. You know, let me be able to just tell you what I'm feeling, you know, without even having to worry about it coming back to me, you know, just show some empathy maybe. But the main thing is to listen without judgment.
I agree.
Thank you, Jennifer. Bill.
Yeah, I agree. I need somebody that's willing to listen to me, even though they may not understand or agree with what I'm talking about. I think by just hearing my voice, hearing what I've got to say, that they're able to learn a lot from me and learn what's going on within me. But I think I also need suggestions. A lot of times I'll seek out the suggestion of somebody that I trust and say, you know, is what I'm thinking or what am I talking about? Is it, you know, is that, you know, is it off the wall? Is it something that, you know, I'm not processing correctly? Because I know during times of crisis, sometimes I don't think very clearly. And so I think it's helpful, you know, for, you know, to listen to what others are saying to me. Oh, you're muted.
What is it that you want to need from others during a time or experience of crisis?
I think during a time of crisis, I think I would need from others encouragement and support, because I know for me, it's a lot of thoughts are racing through my mind, and I may not be able to soundly judge what's the best options for me at that point in time. But I would need someone, basically a cheerleader, someone who encourage me and let me know I've got this, and there's light at the end of the tunnel, basically like hope. And I do admit I may on some level not mistrust the cheerleader, but that I'm requesting. But at this stage, I think I need inspiration that I cannot generate myself to keep me focused on getting well.
Wow. Wow. Inspiration, hope. Sounds like you all need a peer specialist. All right. And another question, and we'll start with, I'll go ahead and start with you, Nigel. What recovery skills or tools do you use to navigate crisis? You're muted. You're muted,
You're
Nigel.
muted.
Sorry. The recovery tools that generally use are tools such as RAP. I tend to pay close attention to the earlier beginning stage of the early warning signs and use an action plan to counter them or backtrack and see how it ended up at this point. And furthermore, what's also important is my wellness tools that keep me healthy state of mind and body. And
What
looking
are some of
forward.
those tools, Nigel?
Say that again, please.
What are some of those wellness tools?
Like a healthy diet, having friends around, a community of supporters, people I trust, and like hiking, cycling, things, lots of outdoor things that generate like a sense of well-being, and meditation, and just being part of a community, feeling loved and appreciated. Those are very helpful to me maintaining a healthy state of mind.
Thank you, Nigel. Jennifer. Recovery skills and tools to navigate crisis. What are those for you?
But for me, I keep my RAP updated. Over the past year and a half, 2 years, I've been having some physical challenges, a lot of medical stuff. But keeping my RAP up to date, I have to change that so frequently here lately. But it's just so that I'm more aware of me and, how I'm acting, how I'm feeling, how I'm behaving. So, me keeping that RAP up to date is really good for me. My wellness tools and just being aware of what are the warning signs, because I'll try to suppress everything like there's nothing wrong, everything is fine, I don't need nothing. But, there's these little demons up here and they're saying, oh, I'm going to get you. So, I pull out my RAP book because what am I not doing to take care of me? Some of my wellness tools are just as simple as getting a little thing of Play-Doh and putting my most favorite fragrances in it and sitting there squeezing it, and just releasing stress, anxiety, whatever it may be. But, it's just being aware of me and knowing that I'm my worst enemy at times. So.
Thank you, Jennifer. Bill.
I think wellness skills and tools for me, the big one is journaling. I try to journal every day. I like to write down what's going on, and if I feel like something's bothering me, and I can also use my RAP plan. I keep that as updated as I can, and reaching out to somebody. That's very important to me. I like to reach out to friends, family, my support group. And, I like to take walks, listen to music. And sometimes it's, just going out and taking a drive to Stone Mountain, doing something like that. Mm-hmm. Those are some of the things that I like to do. But I think my main one is journaling. Because I can go back and read and realize things that I've said or done in the past that are, what I'm currently going through.
Thank you, Bill. And Daisy, what about you? What kinds of recovery skills and tools do you utilize?
Preparedness is one of the biggest things for me. I am just a stickler for preparedness. And I overdo it. I surely do, but I'm trying to do better with that.
Going on here.
It's like I had bought all the toilet paper and the hand towel when it was time, when we were going through COVID. I just overdid it. But one of the things that I do is I wear this imaginary tool belt around me every day. And in this tool belt, I have 3 compartments. And one is for the mind, one is for the body, and the other is for the soul. In the mind compartment, I have all my affirmations and my relaxation methods and cheerful memories. I try to think of things that makes me laugh or good times, from the past. For my body, I have all kinds of menus for nutritional meals and drinks and stuff, herbs that I could use for different things that might be going on in my life. Okay, and for my soul, I try to stay spiritually upbeat. I listen to upbeat music. I like to dance. I used to roller skate. I need to get back into it. I've done extras in movies. I've been on America's Got Talent. So I continue to do things to make me happy. And I love, and in that spiritual box, there's a lot of love that I have to give. And I make sure that I keep myself available to receive what love is coming my way.
That's so beautiful, Daisy. I'm inspired. That's beautiful.
Thank you.
Definitely. Well, that was the end of the questions that I had prepared. I'd like to give you all an opportunity. If there's something, any last word that you'd like to share with folks, regarding treatment and crisis and what it is that would be helpful. Or maybe, what's that thing that please don't do this? Don't send the police and throw me against a police car and lock me up. If there's any parting words before we open it for questions.
Yes, I would like to say to everyone that whatever you focus on, you give power to.
Thank you, Daisy. Nigel, Jennifer, Bill.
Just to say again that in crisis, some of us are in a dual world, and we need support to ground us here in this one, but it doesn't need to be a rough treatment, or it can be supportive, loving, kind treatment to keep us grounded.
Thank you, Nigel. Bill.
I like to encourage people to consider reaching out to others, because there's so many people out there who are willing to listen to you, willing to validate your feelings, willing to listen to what's going on, and just love you. And if you don't reach out, you won't find who they are.
Thank you, Jennifer.
So
Can we? Oh, a person on the phone. Can we mute that person, please? Okay, go ahead, Jennifer.
for me, it's for when people are reaching out and asking for help, don't dehumanize them. Listen to what they're saying, give them the support that they need. Don't identify that what's best for somebody without talking with them. It's important that you listen to what they're saying. And I think listening is the biggest part of anything, being able to really let somebody ground themselves and work on their recovery as they see fit.
Thank you. Thank you. And I hear that what's just resonating with me is that the perspective change from the trauma-informed care perspective, where the question is not what's wrong with you, but what's happened, what's happened, what's going on, and to really see a person, not a diagnosis, and to see a person, beyond the behavior even at times, and recognize that there's a person there, maybe experiencing a lot of pain and confusion. And so some compassion and kindness is what it sounds like is in order. I know that's certainly true for me. I thank you all so very much just for being your authentic selves and being transparent and willing to share some of yourselves with us. Thank you all so much.
Thank you for having me.
Thank you.
Thank
Thank
you.
you.
And right now, I think we're gonna do a little Q&A. And so, I saw Glenda, you've been active in the chat, and I saw you raising your hand. So if you'd like to say something.
I looked up on the internet coping skills, and that is what you can use for your wellness treatment toolbox. It's coping skills, and that's a good place to go and look it up on the internet in your search engine. I mean, you can find hundreds of them. So that's just a suggestion.
Thank you. Thank you. Does anyone have a question or comment for any of our panelists, or just on the content for the day? Todd,
Yes. Can you hear me?
I just want to say.
hang on one second. Hold on 1 second, Todd, and then I'll come back to whoever was speaking next. Go ahead, Todd.
Okay. Well, I just wanted to comment on Miss Taste's comment that whatever you focus on, you give power to. I have been a peer support specialist since 2007, and my diagnosis is paranoid schizophrenia. And a lot of times the peer reality is one of very big emotions. So that's one thing that I keep coming back to is if you have a positive feeling, grab it by the tail. It could take you a very long way. So I really appreciated Daisy Taste's comment. Whatever you focus on, you give power to. I think that is so true, and it really resonated with me.
Thank you.
You're welcome.
I'm not sure who was speaking. I know it was a female.
I think it was Melissa Paul.
Okay, Melissa. Okay, go ahead.
That was me.
Unfortunately, we're not able to hear you clearly. We have time.
I just
Yeah.
want to say, can you hear me better?
Yes.
Can you hear me better?
Yes.
Okay.
No. Yeah.
Could you put your question or your comment in the chat? Do you
I
have?
was trying to share that I found this in.
You keep cutting out, Melissa. We really want to hear what you have to say, but unfortunately, we're not able to. If you could put it in the chat for everyone, I'll read it as soon as you put it in the chat. All right. Sherry, I guess I'll turn it back over to you.
I just wanted to see if we had anything in the chat that Charles O. Williams writes, one group of men and women who will be facing crisis are veterans who live in South Dakota and West Virginia. The VA is shutting down the facilities in South Dakota due to lack of healthcare staff. West Virginia clinics and hospitals are being closed because of staff shortages and not being able to update the facility. Very, very sad to hear. Charles, do you know of anything that anyone can do about that?
No. The key thing about that is not being any suggestions would be 99% nullified, because the South Dakota, a lot of those areas are very isolated because of where they're located, and then West Virginia is the buildings and all need to be updated, and it hasn't been done. Plus they have staff shortages, and any suggestions that any veteran makes 100% of the time, nothing's done about it. Over the last 7 or 8 years, I've made many suggestions, that pop up dealing with some of the issues that are going on and nothing, no action is ever taken on any form. And then the other thing that came up too about the South Dakota and the West Virginia thing is are dealing with doctors. They can't find doctors who want to work there, which is understandable, you know. Anybody ever been to South Dakota? And but the key thing is what they're also finding out is if you're a doctor and you're licensed, say in California, and you're hired by the VA to work, you do not have to have a state medical license. And what they're uncovering is more and more the doctors that are being hired for the VA systems have lost their licenses. You know, if the license they had was in California, now they're working in Georgia, and their backgrounds aren't being checked to find out if things like this are going on. And the same thing goes on with nurses and all, because it's a federal facility, you're not required to have a state license. And you're required to have a license. It doesn't matter if you're, you know, from Oregon and you come here to work and you're approved to work, but there's no background checks done on, you know, what's going on behind scenes of this person professionally. And you know, and over the years I've seen that because I've gotten away from it. Some of the things that go on. And
Thank you,
just,
Charles.
and that's sad because these are veterans. These
One
are
of
men
the,
and women-
this isn't,
These are men and women that put their lives on the line, especially in combat and all.
Yeah, thank you for sharing that, Charles. The conversation we like to continue at some other time. Maybe call the one of the peer-to-peer warm lines and we can talk about it. But thank you for bringing that to us.
one of the things that I'll just put forward here, it's not an answer to the global situation, but I'm happy to report that certified peer specialists have become a prominent presence in the Veterans Administration care, treatment, and support for veterans. And it's something that continues to grow across the country, and something that we can hope for more of in the future. I really do believe that strongly. I also wanted to just say, for whatever it's worth, write to your congressman.
Sherry, if I could, just interestingly enough too, Charles, when you talk about staff shortages and shortages of folks to provide mental health supports and services, we can look right here in Georgia and you know, see a really kind of desperate situation. And quickly, Melissa, who wanted to speak to us, I want to express my gratitude for the peer specialist panelists. I'm a clinical social worker, but also a survivor of complex trauma, and I can personally relate to so much of what you shared. Daisy talked about having to dress up as a cover and being a professional and also in recovery can be frightening as well. Wanting to seem in control overall not only is beneficial, wanting to seem in control overall not only is this beneficial professionally, but I just want to share that it has reminded me how important it is to take care of myself, especially with some emerging issues that I'm facing. Thank you. I am inspired. And I want to just shout out Luke Wagner. Thank you all so much for this, joining from Washington State, where I hope to see peer specialists as a part of every mobile crisis team in the near future. Thank you, Luke, for being here. And thank you, Melissa. And thank you all. Go ahead, Sherry.
Someone asked where they can, I believe it's Angela Bray, asked where they can get the updated forms for PAD. As soon as the the template is in the, is embedded in the legislation. But as soon as it becomes available, we'll certainly put something on the Georgia Mental Health Consumer Network website about it. And we're going to be publishing an article in our next pipeline, our newsletter about it. So keep an eye on the www.gmhcn.org, and we'll have further updates. Okay.
All right. So
And many people express their thanks to the panelists, and so do I. Thank you all so much.
thank you.
Thank you.
So I guess we give it back to Stephanie now. We're at 11:29.
Hey, Roz, I will just go
Okay.
ahead and put the evaluation link from the Southeast MHTTC in the chat for everyone. There it is. Let me know if anyone can't see it. But I just, on behalf of the Southeast MHTTC, want to thank the Georgia Mental Health Consumer Network, Raj, Sherry, Chris, all of our panelists for speaking today and leading us through this amazing event. If everyone could just take a few minutes to fill out the Stamps Are Required survey, it really helps the Southeast MHTTC to gain feedback on events like these and to plan more events, and specifically more events with our dear friends at the Georgia Mental Health Consumer Network. So that will conclude today's event. And if anybody has any questions, you can go to the Southeast MHTTC website, where we will be archiving this event for later viewing if you want to go back. Or you can email us at info@southeastmhtttc.org. Thanks so much, everyone.
Thank you all.
Thank you.
Thank you. This was
Thank you.
remarkable. Thank you all.
Thank you.
Have a great day.
Bye.